Welcome to Say Yes to Chocolate, the podcast where better is the goal, not perfect.
We're your hosts, Dr. Becky and Sara B, bringing you simple, science-backed wellness with a side of real life and a sprinkle of chocolate love, because balance should taste like joy.
If you're ready to simplify your health and thrive in your 40s, 50s, and beyond, you're in the right place. Let's do this.
Welcome back to Say Yes to Chocolate, episode number 4. The podcast where better is the goal and chocolate is always allowed. I'm Sara B with my co-host, Dr. Becky. And today, we're going to talk about something that comes up all the time in women's health, T-scores and DEXA scans and how to read them. And if you've ever had a bone density test, you've seen the mysterious numbers on your results. But what in the world do they actually mean?
Exactly. People will see like a negative 1.0 or a negative 2.5 and immediately get confused. Most people don't really know, or it's never been explained what that number is, how it's calculated, and what it truly is telling them about their bones.
And that's why we're here, to break down in plain English what is a T-score, how to read a DEXA scan, and what does it all actually mean.
If you've been feeling anxious about your results or just want to know how to keep your bones strong, grab your coffee or your dark chocolate and let's decode the numbers together. This is Sara's love language, so she'll be leading the conversation.
Here we go. So if someone has a DEXA scan and they get a T-score, what is that exactly? Because I've seen all sorts of DEXA scans. I've had to help decipher them, and it really is the medical hieroglyphics.
It is. It's like trying to decode some kind of secret language or something. So you're not wrong. Let's simplify this. Your T-score is basically your bone mineral density, so how dense your bones are, compared to a healthy 30-year-old. Because around the age of 30 is when we hit our peak bone mass.
So we're judging ourselves off our 30-year-old self.
Yes, that is exactly correct.
Is it like a report card for my bones?
Well, it kind of is. It's just the gold standard. And the reason that we do this based off of a 30-year-old is, like I said, that's when we reach peak bone mass. So technically, a T-score takes our bone mineral density, which is a raw data number from our DEXA scan or from a REMS scan.
Sure.
We talked about that last episode. So if you missed it, go back and listen. And essentially translates that into a number compared to a healthy 30-year-old, which is our peak bone mass. It's when we would have had the highest bone mass that we're going to have in our life. So essentially it gives us a guesstimate of how much bone has been lost.
Okay. Kind of like a percentage. Roughly a percentage? Did you
It
say
can
that?
very roughly be. That's how we're going to talk about it because I think it's easiest for people to understand it that way. It's not technically a percentage. Scientists will, argue that, but it's conceptually you can think about it that way. It just makes it way easier to understand.
So what exactly do those numbers mean? You might have a negative 1, a negative 1.5, negative 2.
Sure. If you envision like a stoplight, green, yellow, red, essentially we get T-scores anywhere from basically a positive 4 to a negative 4, and anywhere from a T-score of negative 1 and all the way up to positive is considered normal bone density. So a T-score up to negative 1 is essentially nothing to be concerned about. We need to keep monitoring it, but nothing that we need to be doing like intervention right now.
Sure.
When we start to get worried, which is that stoplight, that yellow light warning sign, is if your T-scores are coming back in the negative 1 to negative 2.5 range. And essentially that is osteopenia or the start of bone loss or thinning bones is another way that it'll be worded for you. And then anything that is worse than a negative 2.5 and down is definitely red light. That's when you become diagnosable. The bone disease osteoporosis is diagnosed at that stage.
So if I had a T-score at a negative 2, I'd be yellow.
You would be in the yellow, yes.
Okay.
And essentially what that, so then let's talk about what does that mean? What does negative 2 mean? Realistically, what that actually is, a T-score is, it's negative 2. So it's 2 standard deviations less than normal bone density, less than an average 30-year-old. So let's translate that into plain English. Very, very roughly, we can translate that into a percentage of bone loss. If we have somebody at 30 years old that has normal, healthy, flexible, fracture-resistant bone tissue, and you have a negative 2 T-score, you can visualize that like a 20% bone loss, if that makes sense.
Sure, yep.
A negative 1 T-score would be like 10%. So you've lost 10% of your bone density compared to where you were as a healthy 30-year-old. Osteoporosis sets in at negative 2.5, so that's essentially 25% bone loss, correct?
Correct. Yep.
That would be a way to think about that.
And that seems like a large amount of loss.
It is. I mean, that is essentially a quarter of your bone density has been lost. And again, it's a measure of bone density, not bone quality per se, but the density of your bones, of the cortical outer shell of your bones.
So if nothing changes, what's going to happen to that T-score? If I didn't make any lifestyle changes, I just continued to live in that yellow zone going, I'm not in red, I'm going to be okay, I'm just going to continue as is.
Right.
What would I expect to see over time?
Chances are, especially postmenopausal women, as soon as you've lost estrogen production in menopause, everybody starts to lose bone mass. The average woman, the average healthy woman, will lose anywhere from 1% to 3% bone density per year through the rest of her lifespan. So even if you're in the yellow, you will continue to lose bone density if you don't do something to intervene and slow that bone loss, or stop it, or ideally start to build it back.
Okay. The other thing on DEXA scans, I feel like we've covered the T-score pretty well, kind of explaining what that is. But when you look at the report, it says BMD, previous BMDs, it says the Z-score. The Z-score might also be a negative number. What does that Z-score actually stand for?
So let's talk about BMD. So bone mineral density is literally the raw data of the number that's computed off of the DEXA scan, off of the radiation X-ray beam. That BMD number is what's used to convert into a T-score and then a Z-score. T-score, of course, is comparing you to an average 30-year-old, so we get an idea of how much bone loss there is. That's what we use to diagnose. A Z-score is you compared to other people in your same age group. So it gives you an idea of maybe how healthy your bones are compared to another woman who's, say, 50 or 60 or 70. But it's really for informational purposes only. So we don't diagnose off of a Z-score.
Okay. The other thing, just because there will be more numbers, like if you've had more than one DEXA scan, you're going to see that percentage of change. And
yes,
they're literally just taking your two BMDs, your bone mineral densities, and comparing them.
Correct.
And then calculating either if you have a gain or a loss.
The percent gain or percent loss is calculated off of the bone mineral density number, not off of the T-score.
Okay.
The T-score is a conversion of the bone mineral density, and I know that's super confusing. So say you have a T-score of negative 1.5. Initially, you do some interventions because that's osteopenia, and you know you're in the warning, you got to change some things, and your next DEXA scan, your next bone scan in 2 years or 3 years comes back and you are now negative 1.2 T-score. That's great because you have improved your bone density. But you're not going to take that percentage from 1.5 to 1.2, that 0.3 on a T-score, because it's going to be like a 300% increase.
Sure.
You're going to take the raw data numbers,
the BMDs,
the BMDs, and figure out your percent increase from those. So that's probably going to be more along the lines of a 3 to 4% increase.
Okay.
Somewhere around there.
Okay.
So
sure.
Big difference.
Huge difference, but still also amazing.
Right. And that's why those reports can be so confusing, because there's just so many numbers, there's so many statistics, there's so many just foreign words.
And depending on where you have it done, sometimes they come in a nice chart form, sometimes it's listed out like per body area, like chunks of information, and some of them literally read like a paragraph, and you really actually have to hunt and peck to find the information you're looking for.
Well, and then some reports also include images.
Yeah, and then that's a whole nother realm of how you find that data.
Yes, it can be just really confusing. Just to keep it simple, think of the traffic light or the number grid, green, yellow, red, and interpret those numbers as converted into a percentage. If you have a positive T-score, if you've got a 1 T-score, your bone mineral density at whatever age you are now is 10% better than the average 30-year-old. That's great.
That's awesome.
That's awesome.
The other thing I think is so important to know is you could have a negative 1 or a negative 1.1, which just crosses you over into osteopenia.
Yes.
Or a negative 0.7, but that doesn't necessarily mean that you're severe. Sometimes just that negative, the negative sign on that report, it's very jarring.
Oh, I think so as well. And it can be really scary, especially when you start thinking about fracture risk. But you have to remember, until you've lost, quotation marks, 10% of your bone density, you're still considered normal. Even at a negative 0.5, which is like a 5% bone loss, you're still considered normal because that's the normal aging process. You're going to lose some strength. It's just part of aging. We don't get into the yellow realm until we hit that -1. So just because it's a negative number doesn't necessarily negate that everything is a loss.
Perfect. I think for our listeners and our YouTube watchers, I think this week's KISS action item would be, if you've had a DEXA scan or a bone density scan, is to actually pull out your DEXA scan report, because you've probably got it. It might be in your chart or a paper version. But like most of my people I know and talk to, they file it because they have no idea what any of it means.
Right.
Or ask your provider to provide it to you. Find your T-score for your hip and your spine and go ahead and see where you belong in that stoplight. Are you in that -1 or above in the green? That yellow of that -1 to 2.5, or in the red at -2.5 and lower. But those small steps can really make a big difference for you to be your own advocate in your bone health.
Absolutely. You don't know what you don't know. And as soon as you have that knowledge, then you can start to research and some interventions and things of that nature, lifestyle changes, to start making some real change.
Well, and also to have that conversation with whoever your healthcare provider is too, but you'll go in knowing with the knowledge that you need to be able to have a helpful conversation for your health.
Absolutely. Being your own advocate is the best thing you can do for yourself.
Huge. So that T-score, when we're looking at it, is it telling me what my fracture risk is, or what exactly is that telling us?
Yeah, for sure. Let's clarify that. Your T-score is literally just telling you it's a conversion of your bone mineral density. True bone strength and fracture resistance is multifaceted. You need to know bone quality as well. So a T-score gives us a piece of the puzzle, a piece of the information. Assessing bone quality gives us a much bigger picture when we're talking about actual fracture resistance or fracture prevention. And that can be done by using a couple of other tools. One of those is getting some blood markers to see what your bone is actually doing at a cellular level. And we covered that in Bone Quality versus Density, episode number 2. Yep. There's 4 different blood tests that you can have done to see how well your body's building bone and clearing out old bone. And then we can also assess bone quality and what the actual inside of the bone looks like, not just the outside shell, which is what a T-score is giving us, but that actual inside microarchitecture with a REMS scan, which is ultrasound technology. So a DEXA scan uses X-ray, REMS uses ultrasound. And again, we talked about that in episode number 3. And you can go to echolightmedical.com if you're interested in learning more about the REMS scans or looking to see where one is at in relation to where you live.
Right. And the other really cool thing with the EchoLight is you're also gaining a T-score with that as well.
Oh, yes.
So you're gaining a bone mineral density and a T-score, but then also a percentage of willingness to kind of know where your bone quality is as well.
Yeah. So a T-score right now is what's used in the U.S. and other parts of the world to actually diagnose. So it's a diagnostic measurement in order to do a medical intervention that's primarily medication. But it doesn't give us the full picture as far as fracture risk and fracture prevention.
I'm just thinking, just the conversations we've had over the last 6 years in our community, is we've also used people who've used that T-score to go, I now know where I'm at, and now I know that I have to be making changes. So I need to be looking at what am I doing for movement and putting weight bearing on my bone. I'm looking at the supplements and the diet and what I need to be doing.
The nutrients, micro and macronutrients.
Yes. It can be a very powerful information to know is what is your T-score. It's just not the full picture that we're looking at when we're talking about bone health.
100%. Yeah. Yes. Also, things that maybe are in your life that are working against you with bone health. There's a lot of really common medications that people take that they're totally unaware affect their bone health. And so that can also sometimes be really beneficial information if you do get a T-score that's getting into that scary realm.
And also really shocking.
Absolutely.
The other thing we will probably talk about in the future as well is a lot of stress can actually also really be affecting on that as well.
Stress, lack of sleep. There's all kinds of stuff. So the key takeaway with this is T-score is really easy to understand once you figure out a way to comprehend it, but it's also a small part of the picture. I think the best thing to take away is that there's so many things that you can do that are within your power. If you do get a T-score that is scaring you, or a T-score that says we need to be taking some action.
Alert.
Many things.
Let's be doing something. Also, I would suggest is that Medicare covers DEXA scans at the age of 65.
Yes.
Don't be scared to start asking your doctor ahead of time, even as young as 50. I think it is a little bit harder because of the medium age of 30 to do it sooner. But we've had some people who've started doing them around the age of 50.
Yes. And especially if you have risk factors, whether that is you know that it runs in your family, you have a history of cancer, chemotherapy is very bone wasting, you have thyroid disease is very bone wasting. If you've been on any kind of corticosteroids, whether it's because of an autoimmune condition or because you have asthma, severe allergies, corticosteroid medications are very bone wasting. Acid reflux medications. A lot of women are on acid reflux medications and are pretty shocked when they get that first DEXA scan. There's just educating yourself and taking that T-score information and then knowing some different avenues of either we need to be looking at those medications and having that conversation with your medical doctor, your medication prescriber, and you just knowing that knowledge allows you to make decisions that will serve you for your future.
Absolutely. So I'm pretty sure we just came up with the next episode. I'm pretty sure we're going to talk about coming up, actually, is those things that affect the holes in the bucket, essentially, the things that kind of are negatively affecting our bones.
Yes, for sure.
Yep, we just made that decision on the podcast.
Which is kind of how we roll. Here we go. Yeah, a little insight into the behind the scenes of how things usually...
So also on that note, if you do have some more questions or need some clarifications, feel free to comment or send us an email as well. We love getting emails, and if you have some suggestions too, go ahead and send that to us.
We're here for you. Yeah. Whatever you want us to cover is invaluable for us to know. So,
If this episode helped clear up some confusion, send it to a friend who's on her own bone health journey, and make sure you hit that subscribe button so you never miss an episode.
So we'll see you next week with some more simple, sustainable ways to say yes to your health.
Thanks for hanging out with us on Say Yes to Chocolate.
If today's episode gave you a win, something to think about, or even just a smile, we'd love it if you'd subscribe, rate, and share it with a friend.
Want more? Join our email newsletter so you don't miss a beat, and come find us on all the social channels at Say Yes to Chocolate Podcast for all the quick hints and tips.
And don't forget, you can always send us your questions or episode ideas. We love hearing from you.
Until next time, keep it simple, stay curious, and always say yes to chocolate.